I've sat at the bedside of more dying patients than I can count. And for years, I assumed I knew what they'd say when I asked them what they regretted most. I was wrong. Almost every single time. I expected to hear about the cigarettes, the diet, the exercise they skipped. As a doctor, that's what I was trained to listen for. But that's not what came up. Not even close. There's actual research behind this. A study out of Cornell University surveyed over 1,500 Americans in their 70s, 80s, 90s, and beyond, asking them directly what they'd do differently. When researchers analyzed the data, health and diet barely showed up at all in the top regrets. What showed up again and again were relationships, courage, and time. I remember one patient specifically. I'll call her Margaret, 84 years old, sharp as anyone I've ever met. I asked her the question, and she didn't hesitate for even a second before she answered. Her answer had nothing to do with her body, nothing to do with her health at all. Before I tell you what she said, I want you to actually think about this yourself for a second. If someone asked you right now, honestly, what you regret most in your life, what would you say? Hold that thought. I think you're going to be surprised by how closely it matches what I'm about to share. Here's what I hear, over and over, more than anything else. I wish I had spent more time with the people I loved, instead of the job. I wish I had said what I actually felt, instead of staying quiet to keep the peace. I wish I hadn't spent so many years angry at someone I've since forgiven. I just wish I'd forgiven them sooner. I wish I told my father I forgave him before he passed. I wish I had let myself be happier, instead of waiting for some perfect moment that never came. Margaret's answer, by the way, she told me she wished she'd called her sister more. They'd had a falling out in their 40s over something she couldn't even fully remember anymore. And by the time she tried to repair it, her sister had passed. 30 years of silence, over something neither of them could remember. And it wasn't just Margaret. I had another patient, a retired accountant in his late 80s, tell me almost the exact same thing, but about his career instead. He'd worked 60-hour weeks for 30 straight years, missed almost every one of his kids' recitals and games, telling himself he was doing it for them. When I asked what he regretted, he didn't say the extra hours he could have spent resting. He said he wished he'd been in the audience. This lines up almost exactly with research from a well-known hospice care observer named Bronnie Ware, who spent years documenting the most common regrets she heard from dying patients. Time and again, the same handful of themes came up. Wishing they'd lived true to themselves instead of what others expected, wishing they hadn't worked so much, wishing they'd expressed their feelings honestly, wishing they'd stayed in touch with friends, and wishing they'd simply let themselves be happier. Almost nobody, at the very end, talks about their cholesterol numbers. Now, you might be thinking, that's touching, but I'm a health channel. Why does this matter for my body? Here's why it matters enormously. The Harvard Study of Adult Development is the longest-running study on human happiness and health ever conducted. It began in 1938 and has tracked the same participants and their families for more than 80 years, through their entire adult lives into old age. Robert Waldinger, the psychiatrist who now leads the study, has said publicly that the clearest message from 8 decades of data is simply this: good relationships keep us happier and healthier, period. Loneliness and disconnection don't just feel bad emotionally. They raise inflammation in your body, they raise blood pressure, and research has linked chronic social isolation to a significantly higher risk of heart disease and early death. Some researchers have even compared the health impact of chronic loneliness to smoking roughly 15 cigarettes a day in terms of its effect on mortality risk. That comparison alone should tell you how seriously your relationships deserve to be treated as part of your health, not separate from it. So when my patients tell me they regret losing touch with people, they're not just describing an emotional wound. They're describing something that measurably affected their physical health for years. I want to ask you honestly, is there someone you've lost touch with that you still think about? A friend, a sibling, someone you had a falling out with years ago? Comment their name, or just say, yes, if you're not ready to share more. I read every single comment. So what do you do with this? You can't undo the past, but you can absolutely act on it today, and I want to give you something real, not just a nice sentiment. First, make one call this week. Not a text, an actual call. To the person you thought of just now when I asked that question. You don't need the perfect words. You just need to start. Second, say the thing you've been holding back. Whether it's "I love you," "I'm proud of you," or even "I'm sorry." The research on this is consistent. People rarely regret saying something honest. They regret the years of silence. Third, protect time with people the same way you'd protect a medical appointment. Put it on the calendar. Treat a visit with your grandchildren or a call with an old friend with the same seriousness you'd give a doctor's visit, because based on everything we just talked about, it may matter just as much for your long-term health. And if in-person visits aren't possible because of distance or health, don't underestimate a simple phone call or even a handwritten letter. Research on social connection consistently shows that the depth of contact matters far more than the format. A genuine 10-minute phone call can do more for both of you than most people realize. Finally, if there's a relationship that ended in hurt or silence, consider whether reaching out is possible. Not every relationship can or should be repaired, and that's okay too. But if it's simply been years of silence with no real reason behind it, Margaret's story is worth remembering. I think about Margaret often, not because her story is unique. It isn't. It's because it's so common that I've stopped being surprised by it and started being determined to say something about it before it's someone else's turn to feel that same regret. I've learned more about how to live from my oldest patients than from almost anything else in my career. And the lesson is almost always the same. It's not the things you did that you'll regret most. It's the people you didn't reach, the words you didn't say, and the years you let slip by waiting for the right moment. I don't say any of this to make you sad. I say it because you're still here, watching this, which means there's still time to do something about it. And that's a genuine gift most of my patients would tell you not to waste. You still have time. That's the whole point of this video. If this moved you today, hit that thumbs up and share it with someone you've been meaning to call. Subscribe if you haven't already, because every week I bring you honest, doctor-backed insight into living better after 60, not just longer. And in the comments, I really do want to know, what's one thing you're going to do this week because of this video? I'll be reading every response. Take care of each other.